Treatment for an injury is similar to taking medication. We can give enough dosage to be effective, but if we give too much, it can make the problem worse and cause more damage. Too many manual therapists think a response from treatment can only go one of two ways. Number one is it can make the problem better. Number two is it won't make the problem better. The one that always gets ignored is that the treatment can actually make the problem worse. In this video, I cover the importance of making sure to get the treatment dosage just right to not only help fix the problem, but keep it from getting worse or flaring up. The problem with doing too much treatment. I got this idea from this video from a question from someone on one of my YouTube videos and thought it would be a good one to explain more in depth over video form. Let me pull the question up. It said, I have never heard of dosage as a massage therapist. How did you get to this place to determine soft tissue work only needs the right amount of time in the treatment? So one thing we have to focus on is the importance of recognizing all the factors in the injury presentation. I covered this more in depth in a full webinar. I'll link it up top here if you're watching this on YouTube. If you're consuming it anywhere else, I will put it down in the description notes below. But there's 4 components to the injury. They don't just live in a bubble. One is going to be a tissue problem. Next is going to be a structural problem, and the metabolic problem, and then a psychosocial problem. So for simplicity in this visit, let's pretend that you got a client that came in. They take relatively good care of their body. They're not batshit crazy. So now what we're left with is a tissue component and a structural component. So what do I consider tissue components? One's going to be the fascia, the ligament, the muscles, and then some nerve entrapment. So nerve entrapment is basically over time as scar tissue forms in the muscles, the fascia around the ligament, gets bigger and bigger, and eventually the nerve entrapment happens as well. The nerve basically gets stuck, presents with like some numbness, aching, burning, tension. And then what do I consider a structural problem? It's going to be a bone problem, a cartilage problem, a disc problem, and a tendon problem. And this is just where I get my start and where I begin, because it's important to collect a bunch of data and be able to figure out exactly what the problem is. But here's the thing, most manual therapists don't even want to do that. They just want to jump right into treatment without having a clue as to what the hell's going on. This is why you never get consistent results. Struggle to have a plan, or become a non-stop technique certification junkie that's always looking for a new and improved way to fix problems. Here's the truth. It's not more technique. It's learning to slow the hell down. Use your brain and think critically. Yeah, slow down. Use your brain. Think critically. Unfortunately, 95% of manual providers out there are allergic to thinking critically and just want to completely skip this part. Now that my mini side rant is over, let's get back to the topic of treatment dosage. So for me, in my system called the PEAK method, it's called the PEAK injury evaluation and treatment method. So the evaluation is very key. I've taken the client through a very thorough history. Yeah, got to ask questions so you know what the hell's wrong. Then I perform a very detailed evaluation. And now I have an accurate diagnosis about what is going on. Now you might be saying, because a lot of people say this, especially a manual therapist, they're like, it's kind of nonsense. You might say, well, my license doesn't technically allow me to diagnose, so I don't do it. That's bullshit. It doesn't keep you from being able to know what's wrong with your client, because how in the hell can you fix a problem if you don't know what it is in the first place? Food for thought. So my list might look something like this, my tissue specific list. I might have some scar tissue in the surrounding muscles, in the fascia, in the ligament. I identified that through a full functional evaluation, a detailed and precise palpation. I might also have some nerve entrapments near that dysfunction. And then lastly, some degeneration of one of the structures. Maybe it's a bone, cartilage, disc, tendon, depending on where the injury is in the body. So what is degeneration? Degeneration is just a general term that your body or that area just got older before its time, and that's where the issue ends up being. So I have a good list. I have tissue problem, nerve entrapment, degeneration. I'm able to figure out how much of each thing is in there. Like I said, it doesn't live in a bubble. It isn't just strictly a soft tissue problem or strictly a degeneration problem. That's what we run into a lot in therapy and treatments. You know, on the one side, manual therapists are all like, it's all a tissue problem. And then on the other side, the orthopedic surgeons, like, it's all degeneration. You're both wrong. It's somewhere in the middle. So what would my treatment be? It would be two parts. You know, first thing I want to do is restore the range of motion in the injured area by getting the precise amount of depth and tension on the area using my hands. Remember, I'm a manual therapist. I'm going to use my hands. I'm not going to use cups. I'm not going to use a bunch of weird shit, exercises or tape. I'm going to use my hands because I'm a manual therapist. And sometimes I will use instruments. I use that mostly in the fascia or the ligaments. Now, you might also be saying to yourself, I'm a manual therapist. Okay, yep, that you're a manual therapist. I'm a manual therapist. I can really only treat the tissue. So how could I ever make a difference in the structural issues? You know, the bone, cartilage, disc, and tendon. Isn't that meant for like the chiropractors for the bone, the surgeons and things like that? Here's the thing. I say, think of the degeneration as the client's thumb, and it's stuck inside a car door. The car door is all that bad tissue around there in the fascia, in the ligaments, in the nerves, in the muscles. You can't give this a chance to heal up until you remove that car door. That's where the manual therapy comes in, with precise depth, precise tension through a full range of motion. We are not beating the shit out of the tissue. Everyone's like, oh, it looks like myofascial release. Yeah, on the surface, it looks like that, but the details are way more precise, way more focused. So back to the question about dosage, since I kind of took us down a windy path, but it got us back to where we are with the dosage. How do I approach treatment? You know, a big thing that I say, you know, I teach you how to cut your treatment times by 50%. It's really more like 75 or 80%. And the way we treat in my system, the peak method, is it's a very focused and shorter session, 15 to 20 minutes. And what I do is we have all these functional based tests. I pick one test and then two structures, and that's all I'm going to treat for that day. And I never do any more than what I call 7 to 10 treatment passes on an area of dysfunction. So I find it, I locate it, shorten it, proper depth, proper tension, go through a full range of motion, 7 to 10 on that, and then I'm done. And then I recheck the test. I should see an improvement in the test. I always say the treatment is kind of like giving you an antibiotic. Say you're sick, you go to the doctor, and they're like, here, you need to take this 10-day antibiotic regimen, right? You want to take one at a time. You wouldn't take all 10 the first day. No, it would mess you up. It would cause problems. But that's what happens when you're throwing the kitchen sink at it and you're doing an hour and a half, 2-hour session, doing everything you got, all those special techniques that you went and took a weekend course and never really learned how to master it. You're throwing it all there. It'd be like taking the whole bottle of antibiotics. It would mess you up and it would cause problems. We want the treatment to be safe and effective, and that's where the dosage comes in. We want to have the right amount of dosage, because if we overdo it, it's going to piss things off and cause some problems. So when you do those long, drawn-out sessions where you're treating everything and everywhere, what you're actually doing is exposing the degeneration more, which in turn will flare it up, and it's going to create more inflammation and increase healing time. What happens, though, in the short term with the treatment, it does play a trick on the body and everything going on, because they temporarily do feel better. And the reason they feel better, so get a little fancy here, but in your spinal cord, in the way things track, you have this space called the lateral spinal thalamic tract. And basically two things kind of travel up there. One is vibration and movement. That's caused by the mechanoreceptors. And then you have pain. That's caused by the nociceptors. And basically what happens is anytime you stimulate a tissue, it gets those mechanoreceptors going, which in turn will block some of that pain, so they temporarily feel better. It's the same thing when you jam your thumb in the door, you shake it out, it feels better. That's why when people get an adjustment, they might temporarily feel better, but it's not fixing anything because you didn't make any actual changes in the tissue. And then what happens is these people feel better and they think they're better, but we didn't improve any of the function. They expose it. That problem gets worse down the road, and that's going to cause the degeneration to get exposed even more. We only want to have a certain amount of time under tension and then be done. Get in there, get out, and be done, and let the body heal up. The key is to focus on not only doing the exact treatment that it needs, but understanding that less is always better than more in this situation, because you can't go back after doing too much. The damage will already be done. So like, say you took all 10 of the antibiotics, like they're in there, can't go back. But if we get the dosage right and we apply it each time, basically what I'm trying to do is get about 5 to 7% better per treatment. And over 10 treatments, we're 50 to 70% better, but it's a more effective dose. It's like we're getting that pill and doing a little bit each day and letting it do its thing. So that's all I got for you guys in this video. Share your thoughts below in the comment sections, or any insights that you might have changed your perspective on the idea of like doing more effective but shorter treatments. Go grab access to our free training modules. In all honesty, they're better than most paid courses out there. All the links for that are available in the description or wherever you're consuming this. Another thing is, like, I talk about this all the time, be a clinician first. Learn to critically think, figure out problems, solve them, know what's going on, then a technician second. Don't be one of those people that are like, have the client tell you like what's wrong for like a minute. They hop on the table and you just start, plowing away, trying to figure out what's going on. You don't have a plan, and all you're really doing is just winging it and not getting to the root cause of what's going on. And really, like I said, start focusing on the whole working smarter, not harder side of things. It's going to be really key. Working smarter, not harder. You have better focus. You know what's going on, and you can start solving problems instead of trying to do everything under the sun, doing every treatment that you've ever done and not really knowing what's working, and working really hard and beating your body up, and also keeping your clients from actually getting better. Appreciate you guys watching, and we'll see you on the next one. Bye.